Time doesn't do anything but pass. Healing is active. If people are going to heal, it's because of what they do with the time. And the most active ingredient in healing is letting go.
Hi and welcome to Lead Well. Hi, Dr. Christopher Cortman. Dr. Chris.
Thank you so much, Christine, for having me here.
So you are a clinical psychologist with over 40 years of experience helping people navigate trauma, anxiety, grief, and emotional challenges. With more than 80,000 hours of therapy, you have a deep understanding of what truly supports healing. And you recently wrote a book, The Guided Imagery Cure, where you explore how guided imagery can help people process unresolved experiences and release emotional burdens. Your work challenges the idea that time alone heals trauma, and you emphasize the importance of actively working through difficult experiences. And you continue to focus on practical ways to help people move beyond trauma and find greater ease in life. I'm so excited to have you on my show, and I'm so very much looking forward to this conversation. And my first question is already about this because there is this assumption out there in the public that you just have to wait long enough because time will heal all wounds. And so you're saying that's not the case.
I have been saying that's not the case for a long time now because I've had the opportunity to work with so many people who were traumatized when they were younger, and they're still carrying that until we meet and do something active to put that trauma in a better place. And you know what I think is better than just stating that is to tell a story or two that substantiates what I'm saying. So if you don't mind, I'll just make that segue right into a story. So a 31-year-old woman comes in to see me, and I'm doing the initial interview and what brings you here thing. And she says, my primary care physician referred me here because I have not responded well to any of the antidepressants that he has prescribed for me. And I said to her, how long have you been depressed? About. And she says, oh, no, not about. I can tell you the exact day. It's been 12 years when she was 19. And she tells me this story about her 12-year-old brother being her favorite person in the world. And she begins by telling the story that they were shopping in a Walmart type place, and he disappears for a few minutes while she's looking around in the aisles, and she can't find him. And she thinks, if something ever happened to my brother on my watch, I would be horrified. She finds him and is so relieved. But then literally 5 minutes after she leaves, she pulls too far out in traffic, and a truck comes and swerves and hits her brother and misses her completely. It was her fault, and her 12-year-old brother is dead. And she said since that time, she has felt horrible. She's been depressed. She's been sad. She's been so guilty. She thinks about him. He had his whole life ahead, and she ruined it with her poor judgment in driving. So I asked her very early on, would you be willing to try a guided imagery technique? I find out, where do you stand religiously, spiritually? What do you believe happens? And after death? And she says, I believe in a heaven, I believe in God and Jesus, but I'm not really an active religious person. I don't go to church, but I believe that. I said, okay, if you're okay with it, then I'd like to do a guided imagery. And the point of our imagery is to try to get you in a better place with this whole thing. And if it's okay with you, we will have a meeting in your mind with your brother, and we'll meet him anywhere you want. And she said, I could meet him in heaven or wherever. And I said, okay. So my job at that point is to get her relaxed. So we do 5-10 minutes of relaxation training. And then when she's ready, I want her to go someplace where she can see and experience her brother. And I'm narrating, and I said, I'd like to speak for him. but I want you to hear it as if it's coming out of his mouth, right?
Mm.
You can see him, you can hear, this is whatever you imagine heaven should look like. And so I speak for him and I say, I have permission to meet with you. And it's beautiful here. I'm happy here. I'm well taken care of. I'm not hurting. I'm not suffering. And I miss you. But I don't want to think that every time you think about me, you're sad and feel bad. You were my favorite person, and we were so close. And I'm happy here, and I want you to know that one day you'll be here with me. I don't know when, but we'll be together again. It's okay. I want you to be able to forgive yourself and get on with your life because you have more life to live. I needed to be here. I can't tell you why, but I can just tell you we'll be together again, and your life is not over there. Mine was. And so I can see she's complying with it. She's crying. She feels like this is real. She's seeing him. And so that's a trick on the nervous system, like dreams are. A dream is a movie that you wrote, directed, and starred in, but it's real. You feel it while you're dreaming. And so in this case, she's feeling and hearing and experiencing him. And he says, I want you, when you think about me, to be happy that we love each other and we'll be together again. I want you to think of, because that's how I think of you. I always love you. And before he stopped, I said, oh, and tell mom there's no curfew here. So I'm pretty happy here. And I could see she's smiling when I told her that. So I bring her back out. And usually when I bring people out of these things, they're very quiet. But I asked them, how was it? And one of the things that is linked with almost 100% success is when they go, that was so real. When they say that, then I know it happened. Not really, but in their head it happened, and therefore it's real to the nervous system. So a week later, she comes in, and of course, I want to know how it went. I usually ask people to write out what it was like for them because even though they feel like I know everything because I was talking, I don't really know what happened in the silence of their head. But she says, Dr. Cortman, I can't get that to a bad place if I try. When I think of my brother now, I see him happy and well. I am finally okay with that. And so that wasn't because time passed. Time passed 12 years, and all she did was go deeper into depression. No healing. She was going to spend the rest of her life blaming herself, ruining her life because she ruined his life. That was her thinking. But instead, we tweaked something there, not just as a concept, but she experienced it. She felt it, which is what? He's well now. He's healthy. He's happy. I will be with him again. There's hope. I got more to do here. I better get going. I wasted 12 years, but he's fine where he is. And the only other thing she said to me that day is, would you be willing to do this with my mother? That was her son. That's the story. So the point being, I have all these stories of people who were stuck. Time doesn't do anything but pass.
Mm.
Healing is active. If people are going to heal, it's because of what they do with the time. And the most active ingredient in healing is letting go. You could call it acceptance, you could call it forgiveness, making peace with, releasing, whatever you want to call it, but it's the same thing. I have to say goodbye to something. I have to release something in order to heal.
Wow. You mentioned the nervous system several times, and I'm really interested in everything nervous system, especially the autonomous nervous system. Can you share with us what actually happens in the nervous system when a person gets traumatized and how that changes then with the guided imagery?
Yeah, recognize that I'm a psychologist. I'm not a medical person. I've read on this. I have some knowledge, but I don't claim to be an expert on the nervous system. What I have read, what I understand, is that changes take place after a trauma, and we're responding less cognitively in the prefrontal cortex of the brain and more from the amygdala and the limbic system, which is more about fight or flight and emotion and quick igniting of terror. And what one of the main branches of symptoms for post traumatic stress disorder is avoidance. And people will avoid that which triggers that. There are symptoms like an exaggerated startle response. This week in America, it's the 250th celebration of our independence, and there's going to be fireworks everywhere, and there's going to be military people avoiding fireworks everywhere because that kind of boom explodes, that triggers memories in the brain and makes them want to hit the floor for cover, even though it's just beautiful fireworks in the sky. It's not incoming. So it's often compared to a hostile takeover of the brain, and it makes people inclined to not only avoid but to experience things very powerful, and creates another symptom called hypervigilance, where you're overly watchful. You got in a car accident, and instead of being able to just drive comfortably, you're looking around frantically because somebody hit you in the back that one time, and when is that going to happen again? The mind remembers that. So we're not responding so much with our prefrontal cortex, our thinking, the most evolved center of the brain, if you will. We're reacting to from the emotional area and over. And so what guided imagery does often is it helps people kind of calm that down, that whole response, and release. And I just have so many stories, both in the book and not in the book, because I had some training in it, Chris, and the training, like most of us were taught way back when, was that guided imagery has been around for centuries, but we've used it for relaxation, for insomnia. You may have watched some of the Olympics in February, the Winter Olympics, but they were talking about people using guided imagery to perfect their downhill skiing, to perfect their ice skating. People use it for sports, for performance, but I started using it for two areas that have been incredibly rewarding. One of those is trauma, and the other one is grief. And so having people say goodbye to people that they've lost and put them in a better place. So now there's peace about it. How I've used guided imagery, Chris, is if I could define it with one word, it would be closure. Giving them a sense that what has been so painful is now okay. I have people say to me, that's done now. And that doesn't mean I brought people back from death to life or anything like that. But no, now there's an acceptance. Going back to those words I was using, you've accepted, you've released, you've forgiven, you let go, it's okay. That's how we shut off the stress response. When the mind thinks that something is okay, it shuts off the stress response. The stress response begins with arousal. It's fight or flight. It's the alarm reaction. Then it goes into resistance, where you keep fighting in high gear, exhaustion, disease, death. It doesn't go in a good direction. It only goes towards that. And it doesn't shut off on its own. The mind has to say that's okay. The mind has to say, yeah, money comes and money goes, or it's not the end of the world. All right, that's how she thinks. There's a million ways, a million things that we've gone through in the course of a lifetime where we shut off the stress response by saying, hey, what am I going to do? I got to let that go. That's not mine to control. Make peace with that. And that's what we do with imagery, right? We have to put something in a better place.
Yeah, and what I love about that, because a lot of the therapists that I got to know is that they're looking back at the trauma and trying to get at peace with it. But what you're doing is almost telling the person to turn around and look into the future and then imagine the other person, imagine the person that they are missing in another environment, in a future state. Would that be correct to say?
That is correct to say. And it's also correct to say, I will bring people back to a trauma to finish the trauma when that needs to be done.
Now, you told us already a few examples of who is coming to see you. So where is where is almost the threshold of whether I need professional trauma therapy or whether I can use self-regulation practices to heal from my past
That is a
experiences?
great question. And I want to honor that question by first using an analogy. And that is, if you talk to AA people This is an analogy, there's no correlation. Alcoholics Anonymous people. And you say, I don't know if I should go to your meetings. Maybe I should try to stop or moderate my drinking on my own. They would say, that's exactly what you should do. We're open 24/7. Go try it on your own, see how you do. If you can't stop, if it's still a problem, the first step in AA is recognizing that I'm powerless over alcohol. My life's become unmanageable. If you could manage it on your own, you don't need us. We're here for others. So it's the same kind of thing. Let's get away from the analogy and say, imagery, you could do whatever you want with your own imagery. The reason I like guided imagery as a clinician is because sometimes we're going to get into some hairy places. And it's nice to have an experienced clinician who can help you by guiding you to get a good outcome.
It's almost like a safety net as well. It sounds
Well said. Yeah, I want the person to always feel like this is the most challenging thing they're going to do, but it's in the safest room they could be in. I'm in here with you. You're not going to shock me or you're not going to lose me. I'm not going to say, I can't do this. I'm going to go through this. Whatever it is, we're holding hands. We're going in together. There's a room that has a skull and crossbones over the door. It says, keep out. And you and I are stupid enough to go in anyway because we got work to do. We got to clean that out. So it really does a tremendous bonding between client and therapist. But the upside, the potential of the healing is just really fantastic. How about a story here? So this one, don't tell anybody, but this person was not a patient, never has been a patient. She was a friend. She used to clean my house years ago. She moved back to Ohio. We've stayed in touch, always been just a friend. But Christmas night, 3 years ago now, she and her husband have too much to drink. They have a fight, blah, blah, blah. He's just says something nasty, and she says something like, Merry effing Christmas to you too. He goes in the next room and he blows his brains out. And she is devastated, like the worst Christmas thing you could ever imagine. So maybe it's a year and a half later, and she's coming down on vacation, and she's just not doing well. And I say to her, do you want to try? And she says, yeah. I said, come on over for dinner. My wife will make something and we'll do whatever we do on the couch in imagery and then stay for dinner. Which in retrospect, if it didn't go well, I don't know how receptive she would have been to the lasagna, but that's another story. But anyway, she trusts me and she trusted me. And we did the imagery and she wanted to talk to him in a way where I could hear her. It wasn't just in the silence of her head. And I spoke for him. And I said, I have regretted that decision. I'm so sorry I did that to you. And I had drank too much, and it was just an impulsive, stupid decision. And I'm really sorry. And this was so interesting to me. She says to me, but didn't you love me? That was the big part. You did this because you. And I said, of course I loved you. It was me that sometimes I hated. It was me that sometimes I wanted to destroy. I always loved you. That was so powerful for her. And since that time, she wrote something about the experience, and it's in the book. But since that time, the first thing she said is, I could breathe again. For the first time since he died, I feel like I could breathe again. And the second thing is she went out and she started this survivor program for people who have survived suicides and raising money for those people. And they just had a year and they raised, I don't know, 20 something $1,000 in their first year. And they had a little dinner ceremony. And she sent me the video and it was just, oh, that's so beautiful. That in my mind, there's 5 stages in healing, right? It's another one of these things you won't read anywhere. It's kind of my own construction after all these hours. But the fifth stage is reframing. And so in the fifth stage, you not only take the terrible thing and you've kind of worked through it, but now you're using it in a way to make the world a better place. And that's what she's doing. I could see in the room, there's all these people who've survived suicide in some way or another, and they're all together celebrating the 1 year of we're in this together. So many hugs and tears, and we love you. And we're all, what a beautiful thing she did. And it ends up honoring. And instead of like, that was you died that day, but so did I. I died too.
And it turns the event into something meaningful.
That's the reframing. You take the trauma and you turn it in, you work through it and you turn it into the best thing that ever happened. And so is the woman I just told you about, because you take the worst thing ever and you make the world a better place as a result.
Wow. Now, the work you've described with this woman reminded me a lot of constellation work. Where do you see the parallels there?
I do. And one of the things you would hear someone like me say is, you feel free to borrow from every school of thought that makes sense, that works. We all use cognitive behavioral in certain ways. And with cognitive behavioral, they have things like this. They use this thing called systematic desensitization, where you take people through a phobia and it's in imagery. It's in imagery. And Fritz Perls and his Gestalt school of therapy influenced me so much, because he would say people come in with unfinished business and your job is to help them finish the business. I want people to tell me that when I ask them about how the childhood thing we worked on years ago, how is that? And they say, we finished that years ago. I'm done with that. That's not why I'm back. I'm back because my husband has MS and he's a pain in the ass and I need you to help me cope with him. We finished the childhood stuff. So our job is to help people finish. How do you know it's not finished? Because it still hurts. It still causes anxiety. It still causes avoidance. It manifests itself. I'm thinking of a guy now who had an issue with abandonment. He would not allow himself to be close to anybody. And then he tells me that his brother committed suicide, and then 6 months later his mother did. And he was enraged, but he buried it all and he took it out in all of his relationships. So what did we have to do? We had to get him unstuck by going back. And I didn't use imagery in that one. I said, I want you to write a letter to your brother. And he thought it was so hokey. He was a high shot lawyer. But he said it was so powerful and the emotions just came out. He was just so hurt, so wounded, so betrayed, so abandoned, enraged. And he needed to do all that so he could finally release that. And that's what I mean by time doesn't heal all wounds. Time just passed. We had to do something. We had to go back there.
Now, I know we could go on forever. As a last question here, after your 40 years and 80,000 therapy hours, this sounds so incredible. What has surprised you most about how people heal?
That's a great question, too. What surprises me the most is how quickly and easily they can do it after years and years of trying so hard to avoid it. They could just understand that with a little bit of courage and focus. It's like my daughter's room. It's a disaster. But if she just would put the time and energy in, she could clean it out and she'd feel so much better. But every day that she avoids doing it, it just makes her feel worse about herself, her life, her room. Some people have to be brave enough to face whatever it is that's not finished. And so if you could imagine, let's say you got some kind of an abrasion on your arm, and every time you walk around, if somebody accidentally bumps into it, it's like, oh, that hurts so much. And then you finally go to the doctor, and the doctor says, oh my God, that's really infected. And you say, what do we have to do? And I say, I'm so glad you came in, because if you don't do anything, this infection will continue to get worse. And then we're going to have to amputate your arm. But I have some good news. If you let me, I have disinfectant and I can scrub this thing out. It's going to hurt, but I can scrub this thing out and then it'll be better. And then you can keep your arm and you can be fine again. And so you agree because you don't want your arm chopped off. And I go to touch your arm with the disinfectant, and you go, ow, that burns. Are you crazy? And I said, I'm sorry. Here, bite down on this. I'll give you some kind of painkiller, whatever we have to do, but I got to scrub that out. And then having done that, putting the band-aids on, what you find out afterwards is you reach a place where you could do this, and
Mm.
this doesn't hurt. It's healed. It's better. It's fine.
So act on it as quickly as possible and get help for it. Because what I'm hearing is that it's always like the doctor. You're the doctor for the mind, the other person is the doctor for the body. And it's always good to have someone who is an expert to help you with
Yeah,
that.
and stop avoiding whatever it is that's hurting you. Face it appropriately. Find somebody that you trust, you connect with. I tell people when it comes to a therapist, you have to trust them, you have to like them, you have to feel safe with them, connected. You have to feel like they get it. With your psychiatrist, you don't. They just have to understand medication. You don't have to be best friend kind of
Yeah.
thing. But with your therapist, you have to feel like this is safe. I can tell you anything, and all you're going to do is help.
And also, I would love to know that they care.
My first co-author in my very first book is a guy named Harold Chinitzky, and he would say that when he was at Johns Hopkins, they would say, your patients don't care what you know until they know that you care. And then when you care about them and they know they're important to you, then it's possible to go anywhere with them. And I try to emphasize that. I laugh with all of my patients. We have to have fun. They know about crazy things in my life. They know that this is a relationship also. And I want it to be this is the safest and the scariest room at the same time. Scary because of what they bring in, safe because of how I'm going to cherish them, help them, promote them. There's no judgment of them. There's no saying snarky things in my mind, put downs of them. There's never that. There's only understanding of them and then challenging them to take things on and being the best version of themselves.
And other than in psychoanalysis, it doesn't take years, but it can just take one session.
All right. This one is an incredible story to me, even to this day. A woman comes to see me speak at a local church. She goes home, says to her husband, who is 100 years old, I want you to see this guy. Maybe he can finally help you with those dreams of yours. He has these dreams from World War II where he's thrashing about in the bed, screaming, yelling, and she doesn't enjoy sleeping with him. He's 100 years old. And so I have a session with him, and he says, yeah, I have the same nightmare all the time. I was flying in a bomber plane, and I was shot down over Romania. And I was okay. I was a prisoner of war. But what really torments me is I left my buddy on the plane, and I feel as guilty today. Talk about time doesn't heal. I feel as guilty today as 80 years ago when it happened. So I say, maybe we try this guided imagery thing? Of course. So the guy comes to my house. It was during the pandemic, and he has to climb upstairs, the poor guy, climbing up. But he gets to the second floor with the couch. He lays down. I get him relaxed. We're going to the movies, and we're going to watch being shot down out of the plane another time because we're going to go and finish this. Okay, I don't know what happens until the next week, and he writes me this letter. And what happened is when he saw the movie, he was back on the plane, and he saw that his buddy was already dead. That's why he didn't rescue him. But for 80 years, he had this misimpression that he abandoned him, which was the word in psychology is ego dystonic, meaning not okay with the self. How could I have left him to die while I jumped to my safety? So everything made sense in that moment, finally. And he came out of that and that's finally done. I didn't do any disservice. I could let that go. And his wife demonstrated that he's sleeping through the night. And I said to him, what else, while I got you, what else you got in there? And he told me a couple other things, but nothing, that was the big thing. And I said, you're one of the more interesting people I've ever worked with, but it sounds like we've run out of stuff. So why don't we make a follow-up appointment in 80 years? And that was the end of that. It was just a beautiful story of how he was stuck in one place and he just had to go get unstuck. And he even had inaccurate information in his mind that was not okay with him. He couldn't imagine being the kind of soldier that would leave his buddy there to die. And turns out he wasn't, but he believed he was for 80% of his life.
Well, wow, thank you so much for helping all these people, for sharing these stories, because what I feel now is you're giving people hope that even if they have to go through the worst experience, there is a way out. There is a future for everyone.
Chris, you said something that I so appreciate because I will tell people the best antidepressant in the world is hope. When people become depressed, most often I can trace it back with them to the perception of hopelessness. When a person loses hope, they sink like a rock in water. But an injection of hope, and they can magically ascend. This is okay. We can do. Powerlessness is so hard for people. There's nothing I can ever do, and they lose hope, right? So it's so important to have hope.
Wonderful. Thank you for giving the world hope.
Thank you so much. You are a delight to talk to, and I'm really glad we had a chance to meet this morning.
This was Lead Well. Now, what is the one thing that you're taking away from this episode? Please share in the comments below and do share the podcast with your friends and family, but only if you like it.